Dzień dobry, jest ze mną pani Nino Berdzuli, przedstawiciel WHO w Polsce, dyrektor WHO w Polsce, specjalny wysłannik WHO do spraw uchodźców w krajach przyjmujących. Ja się nazywam Dorota Mirska, jestem redaktorem Menedżera Zdrowia i kuriera medycznego. What are the main challenges Poland faces in advancing cervical cancer prevention and control, and what role can WHO play in supporting higher HPV vaccination coverage, screening participation, and public awareness?
Thank you so much for inviting for this dialogue. I'm very happy to discuss the cervical cancer prevention and the control initiative in Poland, and not only in Poland. As you know, the WHO has a formal global endorsement of cervical cancer elimination as a public health problem, which was adopted at the World Health Assemblies, and all countries committed to the targets for the cervical cancer elimination, which is the 90% of girls and young women vaccinated against with the highly effective and evidence-based HPV vaccine, 70% of eligible young women being screened for cervical cancer, and the 90% of women and the young women, those that have the precancerous lesion being treated. And it is very important that Poland introduced in 2023 the gender-based, gender-neutral vaccination, the HPV vaccination, which is the highly effective tool for preventing cervical cancer. And there is quite a bit of progress in terms of the uptake of HPV vaccine in Poland. But reaching at scale, achieving the high vaccination coverage is of course another challenge that Poland, not only Poland is tackling, but also the many countries worldwide are tackling to ensure the equity in the vaccination uptake. And I think there is quite a bit of progress has been made in terms of laying the good foundation for the large-scale vaccination program in Poland. First of all is improving the access to the vaccines and introducing these vaccines into the school-based vaccination programs, introducing these vaccines in pharmacies. These are the good way to improve the convenience factor, for the people, for young women and young girls and the boys, because Poland has the gender-neutral vaccination, to increase the uptake. But of course, the challenges remain, and what is important is to systematically address those challenges.
Okay, and what are the most pressing mental health challenges in Poland today? And what support or policy guidance can WHO provide to help strengthen mental health services and community-based care?
I think I'm just coming, from the panel discussion where there was the very good dialogue from the pilot phase and one of the pilot regions that implemented the mental health system transformation in Małopolska region. And there is an important lesson and important learnings that come from the pilot phase of implementation, the mental health system transformation. And one of the things that stands out from this transformation, the pilot phase of transformation, is rebalancing the system from the hospital-centric towards more community-based mental health care system, which places the people at the center of the mental health care. And there is, of course, there is a lot of learning from the pilot, but it is very important now to take these lessons at the scale. And the Poland now at the turning point in terms of the scaling up the mental health system transformation. In improving and increasing the coverage of the community mental health centers, so that there is an equity here in the perspective. Half of the country has has an access to the community mental health centers, and half of the country does not. And this is and Poland has a very important lessons, learned through the pilot that can be applied to the nationwide scale up of this reform. Stable, predictable funding for the community mental health centers and for the transformation efforts. This is another very important aspect that attention, needs to be paid. And one of the important lessons from the pilot phase implementation of this reform is that the alignment of the key stakeholders, the consensus, among the key stakeholders that need, to transform the mental health system towards community-based model. There is a political will, there is a national strategy, there is, we are very glad and we are very honored that the Ministry of Health invited us, the WHO, to work together with a team for systemic changes that was appointed by the Minister Leszina at that point, last year, to provide the recommendations on the lessons learned, first of all, from the pilot phase of mental health system transformation and how to scale up this reform to the national level. And we're very honored that we were working, with the team, with the Ministry of Health, and the report is ready with the recommendations on the way forward for national scale up.
And how can WHO further support Poland in strengthening health security, including preparedness for health emergencies, early detection of threats, and rapid response capacities?
Of course, the health security is a key pillar and the core of the WHO's work. European Program of Work of the World Health Organization Regional Office for Europe, which was adopted in September by all the member states, identifies the health security as a core pillar for the European Program of Work. Because, we are facing the various threats and the very complex threats. We're living in the times of the perma crisis, when one after the other emergency comes, and in that context, it is very important not just be reactive and responsive to the crisis situation, but have the preparedness and the resilience of the system, health system, and whole of society to these crisis situations. WHO is working, partnering with the member states, with the countries, with the national stakeholders, with the key institutions in the region and at the national level to strengthen this preparedness and to strengthen this resilience and facilitates the cross-border exchange, the cross-border learning between the countries on the emerging threats. And one of the initiatives that we are supporting Poland and facilitating is strengthening the international health regulations and the exchange between the countries, facilitating this exchange between Poland and the neighboring countries. We are working very close with the national and the regional authorities on improving and strengthening the resilience of the hospital sector on preparedness and the response. Last year, we conducted the hospital safety index training for the hospitals across the Poland, which was very well received, and there are recommendations that are coming, from this training. And I think it is a collaborative effort. We need to come together. We need to work together to strengthen this preparedness and resilience for the security of our region.
Thank you very much for the interview. Dziękuję Państwu za uwagę.